Today we're talking about the EZPap. This is a positive airway pressure therapy that to prevent and to treat atelectasis. It can be used with aerosol medication. So before we enter the patient's room, we're going to go ahead and check the patient's chart, make sure there is no contraindications with the patient, facial trauma, throwing up blood, that the patient is alert and oriented. They do need to be alert and oriented to participate with this therapy. We also want to make sure that there's no untreated pneumothorax. So we'll go ahead and collect our things, bring any medication if we're going to use this with the patient, and enter the patient's room, introduce ourselves, tell them we're going to do some positive airway or positive pressure airway management and our therapy, and that's going to treat or prevent any atelectasis that the patient's having, opening up those alveoli. Okay, so we're going to go ahead and set this EZPap up. We'll hook it up to an oxygen source or an air source on the wall and start them off at about 5 liters. We'll instruct the patient to put their mouth around the mouthpiece. We can also use a face mask with this as well. And if the patient is breathing through their nose, we can put a nose clip on. This will only last a couple of minutes, the therapy, but we really want to monitor our patients throughout it, watching the respiratory rate. It's common to hyperventilate through this procedure, so we want to make sure that doesn't happen. And we want them to be, their pressure to be within 10 to 20. It's a therapeutic range. We can adjust that with the flow. So we'll start them off at 5 liters. We can go all the way up into 15 liters if we want to help adjust that we're making sure we're giving with therapeutic pressure in our therapy here. And so, we just make sure we closely monitor the patient's respiratory rate. Afterwards, we'll go ahead and listen to their lung sounds again and see if they have a decreased work of breathing and if their lung sounds have cleared. That's it.